Well, hello, and thank you very much for giving us your time and contributing to this series of interviews. Could I please start by asking you to introduce yourself, your name, where you work?
Okay, I'm Netten. I'm Director of the Personal Social Services Research Unit at the University of Kent, which is a research unit which looks particularly at issues around long-term care. It's really very much its focus. We're particularly interested in quality and outcomes and costs of long-term care.
So you talk about long-term care, and sometimes it's defined differently in different countries. So could you specify a little more what you mean by long-term care?
Well, I see long-term care very much about compensating people for their impairments. In the UK, we use the term social care primarily for that, and that includes places like care homes, it includes home care, but primarily actually it's informal care, people caring for their own relatives and friends.
Thank you. And so if you had to explain to a lay person the job you do, the work you do, how would you explain that briefly?
Well, as I said, I'm Director of a Research Unit, and the unit basically is involved in a number of large-scale and smaller-scale research projects which are looking at the outcomes and well-being of older people and people with learning disabilities and mental health problems and so on. But we're also involved in supporting the work of the Adult Social Care Survey, supporting the ASCOT measure, which is an important piece of work for us now. We also have a theme around costs of health and social care. We're very well used in the costs of health and social care booklet. So there's a number of different areas.
Thank you. And so in terms now of the policy priorities in England, where you're based, what would you say are the top three, in your view, policy priorities in the area of long-term care?
That's very difficult. I mean, we've got funding, which is absolutely critical at the moment, and there's a lot of debate about that, and it sounds as though the government might actually do something which would be good. So the funding is a key issue, but also, and for some time, there's been the issue of personalisation and making sure that people have got personalised services and giving them more control. And then, of course, there's integration of health and social care, which is another very important area. Again, that comes around in cycles and seems to be, again, very important.
So do you expect them to remain there as policy priorities, or for new ones to emerge in the next 5 to 10 years?
I think those are going to carry on being extremely important. I don't see these things as changing fundamentally. In fact, over time, although emphases are different, actually there's quite a lot of commonality across governments going through in terms of policies.
And you mentioned the funding and the funding reform. So on a related question, do you feel like the financial crisis is having an impact on the long-term care system in England at the moment?
Certainly is, yes, absolutely. And I think there's big reductions in funding. Local authorities are having to cut back in various areas, and they're raising eligibility criteria and so on. I think there's a lot of interest in the area of prevention and actually trying to prevent people needing services in the first place or needing more intensive services, but there's a lack of evidence in that area. But that's where local authorities would like to put their money, but actually it is quite difficult to do so, more catching up, as it were, with people with very severe needs.
So now imagine that you were to be in charge of the Ministry of Long-Term Care in England, so you're the Secretary of State, and you can introduce one policy. Which one would you go for?
I think, as far as I'm concerned, really what social care needs more than anything else is more money. It really is basically an underfunded system. And I think you have to look to health, which is potentially the gainer from increased social care. So I think if I could, I'd shift some money from the health services to the social care. I don't imagine that possible, but I'd like to do that.
Thank you. And so far, on the previous questions, we were talking about policy issues. Now, from a research point of view, what sort of piece of research do you think we should do in order to help policy develop in long-term care in England?
I think this is quite tricky. I can see, I mean, I've talked already about prevention. I think if we could get good evidence about prevention, that'd be brilliant. But I think that's actually really, really difficult to do. But I do think that is a very important priority. The other area that I feel strongly about it is the absence of information really about carers' outcomes. Carers are always being mentioned, they're always on the sidelines and so on, but they need to be at the centre because they are fundamental to the whole system. So I think if we knew more about carer outcomes and experiences of carers, that would be very important.
And is that something you're perhaps working on? Or?
Yes, indeed. Yes, indeed. We're working on measuring outcomes for carers and trying to integrate them with service user outcomes.
Brilliant. So now I just wanted to ask you 5 what we're calling the round of quickfire questions, and so I would like you to rate on a scale from 1, where 1 is the bottom and 10 is the top rating, 5 issues related to long-term care in England. The first one is, in your view, so on a scale from 1 to 10, how much of a policy priority do you think long-term care is in England?
I actually think it's higher than it used to be, so I give it a 6. I think it's actually gone over. I think this is one good thing that's happening.
Great. And so thinking about the people on the street, the general public, how aware do you think they are about what the long-term care system has got to offer them were they to need it?
Very, very low. I put it at 1 or 2. Very, very low awareness.
And so thinking about now people who've got those long-term care needs, if you had to rate again the system, how well do you think is the system meeting their needs?
Not that well, really. 3 or 4, I'd have to be at the highest, I think.
Is that the same for publicly supported? Because I understand the English system is means tested, so you're thinking about people supported?
I think actually both, because people who are publicly supported are actually, as I said before, the eligibility criteria are going down, so actually the ability to support people is not as good. I would say that there's some very good moves in personalisation and trying to improve things. It's not entirely bleak, so I wouldn't want to put it too low, so maybe I'll go for a 4. But in terms of self-funders, I think there's a lack of awareness, going back to your earlier question, which makes receipt of services very difficult.
So that's in terms of users. You've already mentioned carers as a priority. So how would you rate the job that the current system is doing in terms of meeting carers?
It's at least they're rising up the policy priority. It is higher than it has been for a very long time. So that's great. It is, but it's still not good what's actually happening for people. Although the new reforms hopefully will potentially improve that. So I think I put that about a 3.
Thank you. And the last one, there's lots of countries talking about integration and the coordination of health and social care. You mentioned it as one of the policy priorities. So at the moment, how would you rate that?
Integration of health and social care. Ooh, 2 or 3? Not good, I don't think.
Okay. Well, thank you very much for your time.
It's a pleasure.